Myself, Dr. Lal Daga. I'm practicing cardiology in Ahmedabad. So today's topic is regarding the what advancement in the hypertension field is. So as we know, the 60% of the deaths are due to the non-communicable disease. Out of those, almost 30% deaths are due to the cardiovascular disease. So this is the leading cause worldwide, including India also. 45% of the patients are above 40 years of age. So in all those cardiovascular death, which is the leading cause in the cardiovascular death or most commonest reason is involvement of all the patients with the hypertension. So it may be silent in 30 to 40% of the patient, but patient will be suffering and developing the complications. So that's the reason almost more than 50 to 60% of the patients remains untreated or suboptimally treated. And some around 30% people are not aware about the disease itself. So that's why it makes very important to attend this issue of hypertension or awareness of the hypertension. So the people should get screened themselves for the hypertension. So there are stages of hypertension. So early stage where the blood pressure is between 130 to 139 systolic or 80 to 89 diastolic. That is called as stage 1 hypertension. Those are the patients with low risk patients, low ASVD score of less than 10% risk. These are the patients, they can be tried with non-pharmacological measures like diet and lifestyle control, where if it is measured for 3 to 6 months monitoring of these patients, almost 50 to 60% patient can recover or can be reversible towards the normal readings. And those are the patients, they just keep to be observed rather than needing the pharmacological treatment. That is the first and very important thing. If you diagnose early, and you can even treat those patients with non-pharmacological measures at the stage 1. Second thing, what is the latest about COVID and hypertension? So there are many patients who develop COVID and lung involvement in the form of ARDS. And there is trial and data regarding the benefits with the metoprolol drugs. So there these patients can be benefited and mortality can be reduced, and those patients can do better with these medications. And rate control of heart rate can be achieved with this, as well as decrease the cardiovascular risk. The another thing is how we can reduce the cardiovascular outcome is we have to achieve the systolic blood pressure between 110 to 130. And that has been proven by the STEP randomized trial recently. So the first thing is we have to do the diet and lifestyle in all the stages. Plus we have to start the non-pharmacological to pharmacological treatment if the patient doesn't respond after 3 to 6 months of non-pharmacological treatment in stage 1. But stage 2 and stage 3, there is no doubt about that. We have to give the pharmacological treatment as well as the dietary precautions we have to continue. The another thing, the office blood pressure or the clinic blood pressure or the hospital blood pressure readings are not the reading which we have to start the blood pressure treatment or hypertension treatment immediately. There is a greater role of ambulatory blood pressure monitoring or home blood pressure monitoring, and that should be almost 48 hours, even at least 24 hours monitoring should be done. And these are the patients where we have to understand what is the variation in the blood pressure. What are the blood pressures in the daytime and what are the blood pressure variations in the nighttime? Because the blood pressure increase of 20 mmHg in systolic or 10 mmHg in diastolic increases the risk by 23%. So the night blood pressure control is very, very important, and that can be known by the ambulatory blood pressure and home blood pressure monitoring. So how we calculate or adjust the blood pressure treatment or hypertensive drugs, that also has to be optimized with the ambulatory blood pressure monitoring or home blood pressure monitoring, because now then we are well aware about which drug has to be kept in the evening time or the night time. The another thing about the latest medications, where the data has come that some of the valsartan molecule, olmesartan, as well as losartan molecules, these are the molecules they may have contains of NDMA, nitrosodimethylamine, and where the long-standing studies for few years, they have found around 20 to 22 patients out of 1 lakh patients have developed some carcinoma incidences. So NDMA molecule has been found to be carcinogenic, and it is proven, and it has been contained in some drugs. So we have to be aware about this latest development, because these drugs were commonly used for treatment of hypertension. So we have to be cautious, and we have to substitute with the safer medications. So these are the newer changes where we have to understand that we have to update ourselves. So ambulatory blood pressure monitoring, home blood pressure monitoring, diet and lifestyle changes, and stage 1 treatment with the non-pharmacological measures have been very, very important and proven benefit. Another thing about COVID and ARDS, where metoprolol has been found to be beneficial. So the another thing we have to keep in our mind in today's era, where a lot of stress and a lot of other things are involved because of the lifestyle and dietary changes, as well as office environment, where the monitoring of AMBP and home blood pressure monitoring can help us, because many patients may have a labile hypertension, but when they're resting BP and other things can be normal. So approach towards labile hypertension is entirely different compared to the our routine treatment of the hypertension, because labile hypertension may be coming for few hours. So where if we do frequent monitoring or 24 hours blood pressure monitoring by AMBP, we will be well aware about when the BP is shooting. So those are the things we have to take care before starting the treatment. Another thing is lot of uses of steroids and the stress environment. Those may have done the acute changes in blood pressure. Then if we do the echocardiogram in these patients and we see the electrocardiogram, we may found if there are chronic changes of hypertension due to the chronic change of hypertension in the heart in the form of LV hypertrophy or not. So that may tell us about the chronicity. And the treatment approach towards these patients different, because if there are acute hypertension, then non-pharmacological measurement may be beneficial before starting the treatment, or mild doses can help for a transient period, then patient can reverse towards the normal phase. If there are LVH or chronic changes are there, then when we can be pretty sure that the patient may have underlying hypertension, and that may have manifested because of some acute involvement. So that is the one thing we have to take care. Sometime patient may be having a hypertension, but because of some acute events or stressful events or some inflammation, patient may have manifested as a hypertension, and we may have diagnosed it as a new hypertension, but it is not new. That may be proven by the echocardiogram. Then if we find LVH in echo, then our approach towards the reversibility or to stop the remodeling, we have to concentrate on proven molecules like ACE inhibitor or ARB in these patients. So that's the one thing. Another thing is, because the period where the blood hypertension has developed and they come to your OPD is usually varies between 3 to 5 years in almost 40-50% patients. So where the urine routine, and particularly for microalbumin, has to be seen if the patient have developed some microvasculopathy or not. So those are the things which has to be taken care to see the involvement of vessels. And where also the ACE inhibitor and ARB has been found to be beneficial to prevent the proteinuria in these patients, so complications can be avoided. Another thing is family history and these endocrine history of these patients are also be taken care, and the uses of junk foods may have suppose the obesity, obstructive sleep apnea, and lifestyle changes, those other causes are also to be seen and to be treated particularly, and those may have contributed towards the hypertension, and that may be fully reversible if you correct the obesity or overweight, as well as the obstructive sleep apnea, or the patient's lifestyle changes because of the working environment and all. If those are corrected, then those patients may have normalized towards the blood pressure. So the temporary or transient treatment may be needed in these patients, but that may not be requirement for a longer period. So those are some developments in these patients of the hypertension where we should consider before starting treatment on these patients. And other proven treatment therapies like salt restriction, diet and lifestyle, then stage 1, stage 2, stage 3, pharmacological recommendation in young patients, those still remains the same. But in the newer time, and particularly in the COVID era, some of the changes which we have discussed may be very important and beneficial to the patient. Thank you very much. Thank you.